The RevLite's Q-switched ND YAG engineering is the gold standard for tattoo removal. Different wavelengths target the full spectrum of tattoo colors. Professional tattoos on average require 8 to 15 or more treatments, while amateur tattoos require 4 or more sessions due to the different composition of inks. The photoacoustic energy shatters the tattoo pigment into tiny particles, which are then eliminated by the body's natural processes. The flat-top beam profile and the photoacoustic action of the RevLite is uniquely effective in clearing tattoos, which have proven resistant to previous ND-YAG therapy.
We're going to start with the 1064 nanometer wavelength here because that is ideal for black ink such as this. And because there's quite a high density of ink in this tattoo, we're going to choose a low fluence for our test spot and go up from there as needed. My endpoint is a crisp white spot, so I'm going to confirm my handpiece is 1064 nanometers, 6 millimeter spot, 1064 nanometers on my faceplate, 6 millimeter spot, 0.9 joules, and 10 hertz. 3, 2, 1. Is that tolerable for you? This crisp white spot is due to, when you look histologically in the skin, it's due to immediate vacuolization, and it dissipates almost immediately. So the whitening that occurs with tattoo removal treatments does not stay, and you need to inform patients of this because they think that you've immediately removed their tattoo and you have not. Now that is a very nice fluence. I can feel in the skin the snapping feel when you're really targeting the ink. So my endpoints are a feel in the skin, a crisp white spot to see, and no pinpoint hemorrhages. And I'm just going to paint over the tattoo, airbrush over it, and cover the whole lesion. We apply topical anesthetic to these for 30 minutes prior to treatment with a combination benzocaine, lidocaine, and tetracaine. And that does help take some of the sting out of the treatments, but all patients invariably feel discomfort with tattoo removal. So immediately after tattoo removal treatment, you want to apply ice. This helps with discomfort, and it also helps reduce risks of complications such as blistering. Blistering almost never occurs with the 1064, but it can occur with the 532 nanometer wavelengths, as it's a shorter wavelength and can cause more epidermal injury. But 1064 is a nice, deep dermal wavelength, rarely causes blistering, and you can see that's a beautiful first treatment for a black tattoo.
Without doubt, the RevLite is the most versatile tool for tattoo removal that's available today. And that's because you have multiple wavelengths from which to choose. Tattoos come in many colors, not only black and green, but red and sometimes a variety of purple, orange, yellow colors as well. And the RevLite, because it gives you 4 different laser wavelengths from which to choose, makes it possible to treat almost any tattoo color, all with just one machine.
Conbio pioneered Q-switched engineering nearly 20 years ago. The MedLite C6 and RevLite are the most advanced and versatile Q-switched ND-YAG platforms for aesthetic practices of any size. An electro-optic Q-switch acts as a high-speed shutter, storing energy in between pulses and delivering a flat-top uniform beam. This enables the laser to produce peak power in short nanosecond pulse widths. The RevLite features next-generation Q-switching with photoacoustic technology pulse, or PTP, which delivers narrow pulse widths at up to 60% more power. PTP delivers a photoacoustic and subtle photothermal effect, allowing for greater collagen stimulation during treatment. Clinical studies indicate PTP mode is effective in all indications and superior in skin rejuvenation with significantly more patient comfort. The MedLite C6 and RevLite Q-switched ND-YAG lasers deliver safe, effective treatment for dermal pigment conditions, including melasma and nevus of Oda on all skin types. Because dermal pigment is deep in the skin, the Q-switch 1064 wavelength is needed to reach the target. Q-switched engineering produces high peak power and nanosecond pulses that vibrate and fragment the pigment. The flat-top beam profile and fast pulses eliminate any risk of scarring or skin damage. Several treatments are needed depending on the amount of pigment and type of skin condition. The MedLite C6 and RevLite offer effective solutions for treating epidermal pigment including age spots, sunspots, and other brown pigment irregularities. The 532 wavelength, highly absorbed by the skin's melanin, is ideal for treating individual brown spots. Photoacoustic energy vibrates and fragments the pigment. A small spot size limits the depth of energy for safe treatment. Pigment turns gray or white once treated, then may appear darker. In 1 to 2 weeks, the skin heals and returns to normal color. With different spot sizes and energy settings, physicians can safely treat the large areas of pigment or sun damage on the entire